So the signs and symptoms, the complaints that patient complain depend on the site. Because as I told you, any artery in the body can get atherosclerosis. The atheromas, they can form anywhere. The commonest is coronary, next is a cerebrovascular vessel. So it depends on which part is which part arteries are atherosclerotic. Is it the renal artery? Is it the coronary? Is it peripheral arteries, or it is cerebrovascular system? So it depends on the site, and it depends on the vulnerability of the organ also. As I told you, brain is most vulnerable. If it occurs in the brain, it occurs in few minutes. If it occurs in other organ, they can tolerate ischemia for long time. Brain cannot tolerate ischemia for long time, as we discussed in stroke. So the signs and symptoms of atherosclerosis depends not only the organ involved, but also the susceptibility of the tolerability of that particular organ. So that's very important. So if it occurs in the coronary artery, you get MI, heart attack. If it occurs in the cerebral vessel, you get stroke. If it occurs in the kidney, you get renal. If it occurs in the peripheral arteries, you get intermediate claudication and all those things. So some diabetic people may require amputation because of this vasculitis. So other insults like your hypertension, your diabetes, your smoking, your obesity, your hypercholesterol, they all accelerate the process of atherosclerosis, which is natural, common in everyone. But these additional insults will, and another thing is there's a family history of atherosclerosis. If somebody has familial hypercholesterolemia, or they have a history of coronary disease in the family, or a brain stroke in the family. So these are the vulnerable groups or people who can get. As I told you, the sites are bifurcation of the artery and the branches. So the main pathogenic process begins as an endothelial damage. As I told you, endothelial damage, the thin layer of the innermost layer of any artery. So then the fat deposit, the LDL deposits take place, and over a period of time, the layer forms and the fat deposition continues. So this is called a plaque, PLAQE. So who will get the disease, who will get a stroke, or who will get an MI, depends on the plaque, the structure of the plaque, atheroma. I'll draw. Can you see the white? You can see. Huh? You can? Yeah. To make you understand better, I think, yes. This is an artery. 3 layers. Three layers: endothelium, adventitia, and media. The 3 layers are there. 3 layers. So what happens is, whenever there is a damage endothelial layer, whenever there is a damage to the endothelial layer here, can you see? Yeah. Whenever there is a damage, as I told you, the macrophages, they come and attack here. They go inside, and the macrophages take along with them the LDL particles. LDL particles go inside and get accumulated. And the second layer, which is muscular layer, the smooth muscle also, they try to patch up, they try to repair this damage, and the smooth muscles are proliferated there. So in the process, the inflammation is a good part here. They play a very vital part in repairing the damage. But if the inflammation is too much, they form this atheroma. This is called atheroma. This takes many years, as I told you. This is called atherosclerosis. Arteriosclerosis is something like that. Arteriosclerosis means the whole thing becomes thick. The whole thing becomes thick and stiff. The contractility of the elasticity of the vessel wall gets hampered, and you become like a cord or like hard ropes. So this is called arteriosclerosis. Arteriosclerosis is age-related and it will occur in everybody. But whereas atherosclerosis occurs in many people, but only few people will become symptomatic if there's any additional risk factors also playing a role. So then what happens? A lot of fat deposits take place inside here. And this is called, first it is called as a fatty streak, stage 1. Fatty streak. Then it becomes a atheroma. And thus we call it as a plaque, P-L-A-Q-U-E. This is called atherosclerotic plaque. So as long as they're in the stable condition, nothing will happen. But when they become unstable, there are two types of plaques. The plaque, I'll show you here. There are two types of plaques. One is thin fibrous cap with less of LDL particle. Second is more of particles. Second is the thick fibrous cap with less particles. So there are two types of atheromatous plaques. This is more vulnerable for rupture because the fibrous cap is very thin. It may rupture any time compared to stiff. That's why sometimes even somebody has a 90% block of this type of plaque, they may not develop symptoms. They may not develop attacks, heart attack. That's why sometimes when you do an angiogram, you will see a silent 80%, 90% block in one of the arteries. This is the reason. Same thing, somebody is only 40% lumen compromised, only 40%, but the plaque is unstable. The fibrous cap is thin, so they may rupture here. This is called plaque rupture, plaque destabilization, plaque fracture, plaque ulceration, plaque fissure, plaque cracks. There are so many terms that we use. So whenever there is a discontinuity or rupture, again, there is a thrombus formation. This is the thrombus. And this thrombus formation, as I already told you last week, this will occur in minutes to seconds to minutes. This is atherosclerotic plaque. This will take about years, decades, and this will take few minutes to 1 hour, 1 or 2 hours. So this is the one which causes MI, not this. Many people, if you do angiogram of a person walking, 50-year-old, 60-year-old man walking on the road, you may see a lot of atherosclerotic plaques in him. But he is not having disease, he is not having MI because there is no thrombus. MI occurs like a sudden. Even the stroke occurs sudden, so mechanism is same. So that is the pathogenesis here.